It is now so glaring that the second wave of the COVID-19 is sweeping through Nigeria like a flood. Also, the new variant that has been discovered is making things really worse. In addition to that, about 80% of the population of the country are asymptomatic, making it really hard to spot this virus in time. However, there is good news in sight, as the COVID-19 vaccine is just about to be introduced into the country. The president of the country, Muhammadu Buhari, and his vice president, Yemi Osinbajo, have decided to take this vaccine on live television to show Nigerians just how safe the vaccine is. Now, ekohotblog is on the streets of Lagos today to get the opinions of people about this vaccine.
Honestly, it won't change the mind of Nigerians, especially I for one. I don't think the vaccine is okay. I mean, it's not really safe because according to research and some speculations, that vaccine has a power and has a power to change one's DNA. Do you understand? It's because it's editable. That is, your DNA is editable. So the vaccine has a power to change the DNA. So if it changes the DNA, that means some people or one or two people might have access to your DNA and they can change anything in your body. So I for one, I will not concur to it. I will not adhere strictly to that instruction that the vaccine is safe, or I will not collect it. Definitely, because from what I heard, Nigeria will be producing theirs locally, but that does not really stop. If the vaccine is safe in quotes, people they might not be able to hold it, because from what I gathered, India and some other countries they are producing it en masse in millions. So definitely, after 1 or 2 years, it will definitely go round. But for the start, just like the way things are being done in this country, they might want to hold it, but as time goes on, it will definitely be definitely people will get it.
Well, I think the COVID-19 vaccine is a welcome one, and since this thing has already started in America and in Europe, I think it's a good one. If the vaccine we can get in Africa and people are vaccinated, and I think the government need to sensitize the people. They need to tell them, inform them that taking the vaccine is very, very important so that they can be safe from COVID-19.
Well, what I just say about it is that, firstly, COVID is real, right? That's where my face marks. And secondly, is about the vaccine that is going to be brought to the country. I believe in it if they can share it around. And it won't harm anybody. It's for the protection of all the citizens of the country against the diseases, because it's a deadly disease. No, they cannot. It's not a thing they can hold it now. You can hold it because it's for humans' use, and they have to distribute it to everybody. So you don't need to hold it because by holding it, it's like you are cleaning Nigerians. That's it. You don't need to hold it at all.
Yeah, of course. I believe to change the minds of a number of people, because leadership is expected to lead by examples. So when they lead by example, when it is shown on TV, definitely a lot of people will see it and then they will believe it, and they may want to follow accordingly. So that's just my feel. If the vaccine works, definitely it will affect people positively. I mean, people will have improvement in their health if it is really working. So that's just my feelings.
And the COVID-19 vaccine that is coming to Nigeria, although it's very good for those of us that believe there is COVID-19, there is this coronavirus, because out of, let me say, 100% of Nigeria, let me say about 80 that do not believe. Those people that are not believe are very few, and for what the president and the vice president have done, I pray maybe Nigeria will emulate them by taking the vaccine.
Yeah, I think it's a good thing that Nigeria is making efforts to get the vaccine. However, from what we have heard, the information out there is that what we are getting is the Pfizer vaccine, and the Pfizer vaccine is the one that has a lot of requirements for keeping it. So it's important that we also negotiate and see the possibility of getting the other vaccines that will not require as much of refrigeration. Of course, they will all require refrigeration, but not to the point, not to the degree that the Pfizer vaccine requires. So it's important that we keep making these efforts to get as much vaccine as vaccines. And what the federal government has also made application for is not enough for our population. I mean, we have 200 million population, and what we are getting is not even up to 100,000. So, and that will not go round, because it will only take about 50,000 people what they are getting. So, and it will be a situation where it will not be able to go round for the people that will necessarily require these vaccines. Yes. Well, I don't think anybody should be afraid of taking the vaccines, because these are vaccines that have been tested, and these are vaccines that have been taken in the countries where they were made. Now, if these people don't believe in the efficacy, not just the efficacy, but the safety of these vaccines, they will not be giving it to their own citizens. So their own citizens have taken it. So I don't think there's any reason for us to be afraid. I mean, we have had vaccines in the past for a couple of things. We've had for Lassa fever, for a number of things, a number of child diseases that we've had vaccines for. And we have seen that a lot of these vaccines are safe. And I don't think there will be any difference when it comes to coronavirus vaccines. And for the president who's going to be taking it in public, and then other officials of government, I think this is a good one for them to take this in public, so that people will be convinced that, yes, these vaccines are safe.
I believe there is a coronavirus, and the vaccine that is coming to Nigeria, I will pray that it works for everyone. But talking about whether people will want to believe it, I believe that not everybody will want to take it, because some people don't believe there is any coronavirus. So it depends on their belief. Like me now, I believe there's coronavirus, and I'm praying towards it that if the vaccine should come to Nigeria, should work for everybody that has the coronavirus.
The vaccine is okay because it's real, because people are dying. I watch it on TV, I read it in the newspaper, I've seen people that got it, and I believe it's real. So if this vaccine will be the solution, the way forward, it's okay, instead of risking our life. So I so much believe that if government can provide, the only issue is that many people may not be able to got this thing by themselves. But if government can make it free, people will definitely take care. I think it's the best to show that this is real. They did it in America. Biden took it. The vice also took it and showed it on TV to tell people that this is real. And they have nothing to hide than to secure people's life. And life is so much important than any other thing.
Well, the issue of the vaccine, it depends on individual. I'm not a scientist. I'm a lawyer. But my own view is that I don't think vaccine is the best solution for this COVID-19. There have been previous diseases, even that are very deadly than this coronavirus. So I believe the money that want to be invested on the vaccine, if it is used to establish or to build standard world-class hospitals, Nigeria will be able to manage it and handle other things. So, but vaccine, if the government believe that's what's the best for now, they are the ruler, so there's nothing we can do to it. But I don't believe much in it.
Nigeria has suffered a lot of pandemic. But this very pandemic, the COVID-19, seems to unite us rather than divide us. We are united by fear, and in the same vein, we are united by hope as a nation. The hope that the introduction of the vaccine into Nigeria is the beginning of the end of the pandemic that has ravaged the nation. My name is Blessings Mosugu, reporting for ekohotblog.